Now, your health, your safety. This is ABC 7 News.
Good afternoon, everyone. I'm Liz Kreutz in for Kristen Z today. Welcome to our daily special called Getting Answers. We are asking experts your question every day at 3 to get answers for you in real time. Today is a topic that probably no one wants to be an expert in, and that is going through the ICU after getting the novel coronavirus. We're talking to a councilman from Southern California who is now recovering. So post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories right now to submit a question, and we will try to get it answered. So let's get right to it and welcome our first guest today. He is a council member in Chula Vista, that is in San Diego County. Steve Padilla, thank you for coming on the show. And Steve, I should tell you that I grew up in San Diego, so I'm super happy to have you here today.
Super happy to be here. Thank you for having me.
And I'm glad to see you're doing better and hear you're doing better. Let's just start with having you share your story, what happened, what your symptoms were, and your past 3 weeks.
Well, it's been quite an odyssey, as you might imagine, and not one that I ever expected or anticipated. I had been actually up in the Bay Area near San Jose to chair a meeting of the California Coastal Commission. It's my honor to serve as the chairman of that commission here in California. And we meet monthly up and down the coast in different locations. And I had been through the San Jose airport the same day I later found out that there were TSA agents who all tested positive in that airport. It's just a theory. I have no way how I was exposed. But during the hearing, it began to feel pretty lousy and ended up coming home early, having some pretty typically flu symptoms and high spiking fevers. Ended up getting tested for coronavirus because I had just flown through an area where there were known possible exposures. And they called me the next day and told me that I was positive. Which I immediately made public because as someone who's a public figure, I come in contact with a lot of people, not all of whom I know personally. So it wasn't like I could pick up the phone and call everyone and say, hey, you might have been exposed. So I made that pretty public. In my case, my deterioration in terms of my symptoms and my ability to kind of breathe and oxygenate appropriately really went downhill really quickly. So within less than 48 hours after I made that diagnosis public, I was in and out of the ER and ultimately admitted at UCSD Thornton Hospital here in San Diego as a patient. And within 24 hours of being admitted to the hospital, I was put into the ICU and on a ventilator and intubated because I simply was not able to breathe.
And how long were you on or in the ICU and on a ventilator, and what was that period like for you?
About 14 days. I was on a ventilator for 11 days, which I have learned firsthand is a blessing and a curse, right? It saved my life. I think the early intervention of my physicians by intubating me quickly, I think really saved my life, because what they told me at the time that they were seeing with COVID-19 patients was that the ones that did get into some respiratory distress, that began having problems breathing, did so very rapidly and could crash very rapidly. And they didn't want to wait to get, for my condition to become that critical. And so they moved pretty quickly and decided, you're not getting enough oxygen. I think you normally take in, 10, 20 respiratory breaths a minute. And I was breathing like 45 a minute. So I was just rapidly, basically panting and not oxygenating. And they pretty quickly put me on a ventilator. That allowed my body to spend all its energy fighting the virus and not just struggling to breathe. But at the same time, there are a lot of risks. The statistics, having come out of the ICU, and I'm very blessed and lucky and grateful to be here, but the statistics about folks with COVID who go on a ventilator are kind of scary because a lot of them never come off of it. So there are a lot of folks that I think a lot about these days that were never able to get wheeled out of the hospital. And I was. So I feel very, very lucky.
Absolutely. And we'll get to some of those concerns that you have. I have I guess it's an op-ed or commentary you wrote in the San Diego Union Tribune. We'll get to that a little bit later. But here's a question we have from Facebook. Someone asked, Did you have any other medical conditions before you became infected with COVID-19?
Well, I'm not a spring chicken anymore. I did have mild asthma and allergies coming up as a kid. I'm kind of a borderline diabetic, not quite diabetic, but my blood sugars are not exactly. Whether those things played a factor in how my body responded to the virus, we really don't know yet. One of the scary things about COVID-19 is that in the medical community and in the research community, they're still learning a lot about this virus. And there just hasn't been a lot of time to assess survivors, as well as the ongoing pandemic itself, to really have that empirical evidence yet. So there's still a lot we just don't know. I'm very curious. I really am curious about, why did I get so sick and why do some others not? Because it's very indiscriminate. There were people much younger than me who were as critically or more critically ill than I was, and people older. So it's a very indiscriminate.
Talk about your symptoms a little bit. I know you said flu-like symptoms, but I think what's interesting for me when I talk to people who have had COVID-19 is it's very different for everybody, and everyone experiences it in a different way. So what was that like for you?
For me, it started off with very mild symptoms, just feeling generally lousy, tired, fatigued, headache, kind of achy all over, the kind of typical mild flu symptoms. And then they just got progressively worse for me. That headache got worse, the body aches got worse. I started having a nagging dry cough. And then for me, the key kind of alarming symptoms were kind of late at night after I'd gone to bed. I started getting very severe shakes, and to the point where my teeth were literally chattering, And I had very high fever, well over 103, which as an adult, as you know, is a scary thing. So I immediately called my primary care provider and their advice nurse, and told them the whole situation. And they basically told me, look, you need to get to an emergency room and you need to get evaluated within the next few hours. And so that actually happened twice, where I went back to the ER twice. The second time I was in a lot worse shape than the first time. I think the first time they thought, they could stabilize me, send me home, let me rest, kind of deal with it like a typical flu. But it became pretty readily apparent that I was going to go into some respiratory distress, that I just wasn't going to be able to breathe and get the oxygen that I needed. And again, they put me in the hospital pretty quickly.
What about testing? Was that quick? What was that process like for you? Because I know there has been a question about a lack of tests and a lagging of tests in California overall.
It's one of the things that's really been on my mind, because as I say in my opinion piece, it should be intolerable to us, the number of uninsured folks in this country and in the state, certainly folks that are just one significant event away from financial disaster, and people who don't have access to preventative care or any health care at all. I'm a very lucky guy. I have good health insurance. I was able to access some of the best, medical facilities, frankly, in the world, and I was very fortunate in that way, that I had access to some of the best care. And folks who were kind of on the front lines and really plugged into what was going on around the world with this virus, and were able to act pretty decisively.
All right. Thank you. We're going to keep chatting on Facebook. We'll be back on air, though, in a moment. We never take breaks, like we said, so we are continuing our live stream. The conversation with Steve Padilla continues online right now. See you in a few minutes.
Any commercial break.
All right. So let's continue here. We're on our Facebook Live still as we're talking, and we're getting a couple questions, a lot of them about the same vein, I think, as we're talking about with symptoms, testing. Someone also asked about the flu shot. I'm curious, did you get the flu shot? Did you think you had the flu at first?
I do get the flu shot every year. I had got my flu shot. I was worried, just simply because, at this point, even though it was sort of early March, there was a lot of heavy international press on this question of the coronavirus. And, as you well know, and its progress from different parts of the world and its first arrival in the United States. So I was a little suspicious. To answer your former question, I apologize about how fast the testing was. In my case, because I had that access to great healthcare, they tested me pretty quickly. When I was in the ER, they tested me both for the regular influenza, A and B, and they tested me for COVID-19. And I think in part because they knew there was a possibility I'd been exposed. and because I had some kind of underlying health conditions. So I think the combination of those two things made them decide, okay, we're going to test this guy. And they did very rapidly.
Right. I mean, and I know San Diego and I know Chula Vista, and I know this is an area close to the border. You're going to have a lot of people that, you know, families, some are in Mexico, some are in San Diego, you know, a lot of people who live kind of in both worlds, really. What has been like the access for folks in your community at large overall?
Overall, well, we still have, again, too many uninsured folks, too many people who just won't even bother to go to a doctor or an ER under these circumstances, folks who will never have access to testing.
You know what? I'm going to have to we're coming back, so stand by 1 sec.
Sure.
Welcome back. We are back with the chair of the California Coastal Commission and council member in Chula Vista, Steve Padilla, who, if you've been watching, you know he recovered from COVID-19, battling it for 3 weeks, even in the ICU on a ventilator. So, council member Padilla, thank you again for being here. And I think in a bit we'll circle back to what we were talking about on the live stream about testing. But we have a question here from Facebook. Autumn is asking, after surviving this, do you do things differently now, like wearing masks or cleaning more? So any changes you've made in your life?
Well, I think those are more, in my case, the changes are more sort of, I don't want to say religious or spiritual, but they are a little spiritual. They're a little more human. They're a little more reflective. They have to do more with, what does this all mean? I was raised a pretty fastidious kid. I came up in a home where, you know, being a slob kind of wasn't tolerated. So I always tried to have pretty good, you know, hygiene and good cleaning habits. Of course, once everyone became aware of the COVID-19 threat, and most of our public health officials were telling us to be extra vigilant, you know, yeah, I did my part. I mean, I was in there, you know, cleaning my hands, not touching my face, doing it multiple times a day, doing it for an extra length of time, just following all the guidelines, trying to keep my distance from people. And obviously, to this day, I have no idea how or when or where I became exposed. But, you know, nobody really is exempt, which is why I really think everyone needs to continue to take this very, very seriously.
Absolutely. Another one, Gil is asking, how long did the shortness of breath last till you went into the hospital?
It came on very rapidly. I want to say it got really acute probably in the, you know, 5 or 6 hours before I actually went back to the hospital. Because by the time I got there, I was really struggling to breathe. And again, they admitted me, I think it was on the 17th. It was St. Patrick's Day of this month, last month, excuse me. And then they intubated me, I believe, the very next day. They put me on a ventilator on the 18th. So it was pretty quick. And the reason they did, again, was I think my O2 sats, as they call them, my oxygen saturation levels in my blood were dropping below 90. Which they typically should be between about 95 and 100% in a healthy person. And so that's just not enough oxygen to all of your organs. And so they put me in the ICU very quickly.
All right, one more question here, and then I want to chat briefly about the article you wrote. Tenzin says, thank you for your time. A question about those machines. I read that many people get more ill after the ventilator has been installed because of germs which are on the machine. So what are your thoughts about that comment? Do you think there's truth to that?
I'm not a doctor and I'm not an expert, but I have been a patient on that. I can tell you the good news is they can save lives. I think in my case they did. They're no panacea. There are high risks. There are the statistics about COVID patients who go on a ventilator and who come off are not great statistics. Certainly there are risks, as I understand it, for other types of infections, because you basically are having a machine breathe for you, which has its benefits and has its risks. So the good news in my experience as a patient was, you know, I was able to consider the decision going in, talk about it with family and my physicians, you know, understand what was going to happen. I don't have any memory of any of it, obviously, which is good, because they basically kind of put you in a medically induced coma, basically. So you're not aware of what's going on at all, which I think is a very good thing. So in my case, you know, I don't really remember sort of being put under, but I do remember coming out of it, and I remember them basically when they sort of de-intubated me, when they removed the tubes and stuff. I remember that sensation. And then I remember being awake in the ICU after that. That was my experience as a patient. So, but your question, you're correct. There are risks to being on a ventilator. They can save lives, but it's not a guarantee.
All right, I'm going to ask you now, talk about, you said here, I spent 11 days on a ventilator and survived COVID-19. Here's what I believe matters most now. What is that?
We need to take seriously the kind of social safety nets that we have in our society, which have been slowly eroded, I think, in recent decades. Family and medical leave, people being one paycheck away from a disaster that could ruin their family and their lives, end them up without shelter, without food, people having food insecurity, people having a lack of access to healthcare. I think, I've always held these beliefs, but having been a patient and having seen the disparities that are being reflected in our society based on this pandemic, it's just put a bright line under it for me. It should be intolerable in this country that there are millions of under and uninsured people that don't have basic access to healthcare, that right now today may be either asymptomatic, walking around spreading this, but have no clue because they don't get regular medical care, or they are symptomatic and they're not going to the doctor and they're not seeking help because they're underinsured or uninsured, or they're just simply afraid. That should be unacceptable in our society. It really should be. Because, if we think we're saving something by not investing in being sure that everyone has basic health care, we're being penny wise and pound foolish as a society. And if this pandemic hasn't demonstrated that, nothing ever will.
Absolutely. Well said. We want to thank you for your time today and opening up to us about your experience and being so public about it. I think that that's important and it helps get the message across. So Councilmember Steve Padilla from Chula Vista, thank you for joining us. We're glad to see you safe and healthy.
Thank you so very much for having me. Be well.
You too. Thank you. All right, we're about to talk live with the president of UCSF Benioff Children's Hospital. We'll talk to him about what he's seeing. And he just returned from D.C. He's helping with the federal plan for children. So we'll have that conversation next. But again, we never take breaks on our live stream. So we will be here chatting for the next few minutes. But we'll see you back here after the break.
We are in commercial break.
All right. Hey, guys, on Facebook that are joining me, or Instagram or YouTube, wherever you're watching, thanks for being here online. We just had a fascinating conversation with the council member from San Diego talking about his own experience of COVID-19. He doesn't know how or where he got it, but he suspects it may have come from San Jose because he was up here in Northern California flying out of the San Jose International Airport right before it came out that folks there were testing positive. So we're going to have UCSF Benioff Children's Hospital president, joining us in just a minute for our live stream. We're setting it up now. He's joining us, and we would love for you to ask us all the questions that you have, and we'll get them answered. Meantime, if you missed them, here are some headlines from Governor Newsom's press conference today. He announced that California, Oregon, and Washington have developed a framework for reopening from the coronavirus pandemic, not just as individual states, but they're doing it as a region. California's specific plan will be released tomorrow. He also said they're providing an additional $200 for families most at risk to help with food and other incidentals. Kim Johnson, who is the director of Department of Social Services, says that they have $6.8 million for additional social workers outreach and $3 million for family resource centers. They are expanding helplines and providing resources through parents. So they also have $313,000 to provide laptops and cell phones to ensure foster youth can be connected as well. So some big updates there, but mainly that tomorrow Governor Newsom is going to be announcing this plan on how he hopes to slowly reopen the state and reopen the economy. So we will be interested to tune in and hear that. But again, we are just a few seconds away now from joining other folks on TV, so stand by.
5, 4, 3.
Welcome back. We are back on air, and joining us now is Dr. Michael Anderson, the president of UCSF's Benioff Children's Hospital. Good afternoon. Thank you so much for joining us. We appreciate your time.
Good afternoon.
All right, let's just have you start by telling us sort of broadly, how is the hospital doing right now? What are you seeing on a day-to-day basis?
Yeah, thank you so much for having me. First and foremost, it's sort of the good news across the world that so far COVID-19 does not seem to affect children in a very negative way. There have been case reports of kids that have become very sick and a couple of rare cases where children have died. But unlike H1N1, unlike seasonal flu, it appears that kids have not been affected very seriously by that. Having said that, we, for the past 7 weeks, have been preparing as a region to make sure that our hospitals are safe, that our caregivers have enough PPE. We've canceled elective surgeries to make room if we had to surge up beds. But I think so far there is good news that kids seem to be less affected than adults as far as the pandemic goes.
That said, though, have you been seeing, patients coming in? And if so, how have they been infected? Is it through a family member, a mother?
Yeah, we've actually only had in the 7 weeks that we've been ramped up, and who knows how long this virus has been here, right? We may, when this is all over, figure that California has seen it earlier than March 17th or whatever the date that we went on lockdown. We've only had 2 positive COVID tests in kids, one at our San Francisco campus and one at our Oakland campus. So once again, winter is a busy time for us, a couple of different viruses, but so far we've been quite lucky that not many kids have been infected.
You just returned from D.C., so I want to talk about that. You're working on a federal plan for children during this crisis. Can you share what that is about and what you're doing?
Sure. The good news I just shared with you, it appears that across the world, less kids are involved. I was very honored that Health and Human Services asked me to come out and think about children's care writ large. In other words, right now, are kids getting the right care? Many pediatricians across the Bay Area are telling us that families are just scared to come to medical facilities. So kids aren't getting vaccines, and maybe kids aren't being seen for illnesses that they should be seen for. So luckily, in this very technologically savvy Bay Area, we're seeing a big ramp up in telehealth where pediatricians and hospitals are saying, well, okay, maybe you don't want to come see us and that's fine, but you and I are doing this via Zoom right now, right? So we're doing a lot more video visits, and I just want to make sure the nation is addressing kids' needs in general. The second is really the fallout of COVID-19. We know that a lot of families and a lot of kids are scared and stressed, and while the good news is very few kids seem to be infected by it, we want to make sure that pediatric mental health is on the top of mind, that families know how to speak to their children about this pandemic, that we have resources in the community for families. So once again, it's good news that the kids don't seem to be affected by this. That would be a much worse picture. But I just want to make sure that we as a nation are prepared for all the other needs of kids at this really trying time.
Why is it, to go off that again about kids not being most at risk, why is it that children don't seem to be getting it at such high rates?
There's a lot of theories that their lungs are healthy and that maybe they get it and it's just a cold. We think that based on CDC data that older males over 60 with things like emphysema or heart problems, that they're more prone to become sicker. So it may be that they're getting infected and having less severe cases. The other thing, we know a lot about the immune system, but we don't know a whole lot. Maybe kids have a different immunity that they can fight this novel virus, even more vigorously than us adults. We do know, however, that kids can be carriers, that kids could have the virus and transmit it to older adults. So I know that staying home with their kids is tough. I know the social distancing is probably starting to wear thin, but we really, as a public health concern, know that kids can have the virus. Thank God they're not terribly sick from it, and they can transmit it. So this notion of social distancing, even though kids aren't getting severe symptoms, is really important.
And Dr. Anderson, really quick, we have about 30 seconds, I think. I'm curious, what do you tell people who are worried to go to the hospital right now, bring their child to the hospital because they think everyone's infected with COVID-19? What do you tell people?
Yeah. First, reach out to your pediatrician or your primary care provider. They've set up some way to answer your questions. Secondly, when I was at Health and Human Services in Washington, we're seeing people really delay going to the ER with very serious things because they're concerned. So not just in kids, but the message has got to be, if you're having chest pain or you think somebody's having a really severe illness, if you have time, contact your primary care provider. But the emergency department is still open and taking precautions. So we don't want people waiting at home because they're scared to get infected.
Very good point. Thank you, Dr. Anderson. We truly appreciate your time and all the work that you are doing. Thank you so much.
My pleasure. Thanks so much.
Thank you. All right, when we come back, Dr. Alok Patel's doctor's note is about herd immunity and what it takes to get there. But we don't take breaks, again, on live stream. So the conversation is going to continue for those of you watching us on the internet or Facebook Live right now or YouTube. So stick with us and we'll be right back. All right, everyone, thanks again for tuning in. I want to just get to a couple points I thought were interesting also from the mayor's press conference today. I know in the last commercial break we talked about Governor Newsom. So she addressed the housing and homeless population, and she said that it's difficult because some people don't comply, and it's more complicated because many have behavioral and substance abuse issues that would require monitoring. She also said staffing hotels for homeless has been challenging. But another thing I thought was interesting, I guess you could say it's very San Francisco, is that Mayor Breed really warned about the looming events that might take place on 4/20 in San Francisco. She said, you know, do not come here. We don't want you here. She said Robin Williams Meadow will be gated off. She urged people not to come to San Francisco to celebrate. She said in the past, you know, they've kind of like let it go. It's a, you know, unsanctioned event. Okay. But this time, no, police are going to be out. They will be making arrests. So her message was do not come to San Francisco on 4/20. Another thing we learned from this press conference is that there's 957 cases now of COVID-19 in San Francisco. And if you were following on Friday, that number is a decent amount higher, and we're told that that is because of the amount of testing they've been doing with the homeless community now and the homeless population. And so we are seeing those numbers go up, and we're told that they expect that number to climb to about 1,000 very soon. 93 people right now in San Francisco are hospitalized for COVID-19, and sadly 15 people have died. But again, Governor Newsom today said that, you know, we are still seeing overall in the state cases tick up, but at a very moderate level. And that's in part to all the work that you and I are doing and all of us are doing to social distance. Okay, stick with us. We're about to come back on TV. Welcome back. We are now able to bring you even more content now that we have this new platform at 3 p.m. every day. And that means we get a daily doctor's note from our special correspondent, Dr. Alok Patel. He is part of our coronavirus team of experts, and every day he's going to talk directly to you about a topic regarding COVID-19. This one has been in the headlines recently.
We're all basically a massive flock of animals the coronavirus is spreading around in, and we need to slow the spread and protect the herd. I'm Dr. Alok Patel, and let's talk about herd immunity on today's COVID-19 Doctor's Note. In order to affect a population, the virus has to jump from person to person. But if we get enough people immunized or protected against it, it's much harder to catch or spread the disease. And all of us, especially those who are high risk, will be protected. This is the concept behind herd immunity. Now, some infections like the measles are really contagious. One case can lead to almost 18 others. So 95% of the people need to be immune in order to stop its spread. COVID-19 is a little less contagious. One case can lead to about 2 or 3. So we need about 60% of the population immune to get to herd immunity with COVID-19. And this is our long-term goal as we talk about slowly reopening society. Think about it. If someone has coronavirus and 60% of the people they come in contact with are immune, we won't see such a rapid rise in infections in the future. Now, there are 2 ways to get herd immunity. 60% of the population could get infected and maybe get natural immunity, but this would also be a huge disaster and we'd see a lot more critical illnesses and deaths. Also, we don't really know who's going to be immune after an infection or even how long it'll last. On the other hand, we can achieve herd immunity with a vaccine, which will be much safer and manageable. This is exactly what we've done with the measles, what we do with seasonal influenza, and many other infectious diseases. It's also the reason we don't see smallpox anymore. Thank you, science. Now, there will still be some people who can't get the vaccine or those who don't have previous immunity. But if everyone around them gets vaccinated and is protected, those who are most vulnerable will be safe and the herd will be stronger.
Thanks to Dr. Patel for that. And again, Governor Newsom tomorrow is going to be announcing his plan for reopening California and the economy. And part of that, he said, will be taking into account this herd immunity. So we'll tune in for that tomorrow. Thank you all for joining us here on this interactive show, Getting Answers. We will be here every day at 3 p.m. on air and on live stream, answering your questions in real time. Facebook Live, YouTube Live, abc7news.com, and on our ABC7 News app. We're also tracking questions that weren't answered, so we'll save them for our next expert. So keep those questions coming. Thanks for joining us. World News Tonight is next. Have a great day.